Welcome back to the Lily List podcast, where we strive to be a handbook for the living. In episode 3, we speak with Dr. Corinne Auman. She's the founder and CEO of Choice Care Navigators, a nationally certified guardian and an advanced professional member of the Aging LifeCare Association. Dr. Auman received her Ph.D. from NC State University, where she studied developmental psychology with a specialty in adulthood and aging. Corinne is also author of the book Keenagers, telling a new story about aging. On top of all that, she's been a friend for many years, and we've been grateful to see her hard work turn into success. Thank you for listening, and as always, you can visit lilylist.com for more information about our work. All right, kick this off. Corinne Auman, Ph.D. Do you go by Dr. Auman?
Only with people I don't like.
So I'll call it, I don't know what category I fall into, but
You can just call me Corinne. It's fine.
So we were chatting before, and I mentioned that when we first met you, which has to be 15 years ago now.
Oh, yeah.
You were professoring, I believe.
Mm-hmm.
And academia comes with its own set of challenges, limitations, hurdles. What was that like for you to be working that job versus where were you going at that time? Where did you see yourself going, and what was the outcome you were hoping for?
Well, so I was teaching full time and but it was a visiting professorship, and things in that when you're in that role at a university, it's a year-to-year kind of contract because they have a need for the short term, but they don't necessarily have a need for the long term. And so their need for me in that role full time came to an end. So I went to part time, and that left me with extra time. And one of the things I had always talked about doing was starting a business that helped people navigate caring for their aging loved ones. Because when I was in middle school, my grandfather passed away very suddenly. We lived right next door to my mom's parents. And after he passed away, it became very clear that my grandmother had dementia. Mm-hmm. And my grandfather had done such a good job of protecting her and caretaking for her that my mom and her sister really had no idea that things were as bad as they were. And then after he passed away, all of a sudden it was like, oh, she can't be left alone, right? And they got thrown into caregiving for her, what it felt like overnight. So they were trying to navigate, okay, how do we make sure somebody's with her 24 hours, 7 days a week? So at first, they hired caregivers who would be there during the day, and then they would alternate bringing her to either our house or my aunt's house every night. And then as things progressed, she was up during the night because that happens as you have dementia. You mix up your days and nights, and that made it very hard for my mom, who was, raising 2 kids, also working a full-time job as a middle school teacher, a very relaxing job. And then her mom was keeping her up all night with, nighttime wakings and things like that. So eventually they had to have her placed in a community, and that did not go great because there was really no guidance. And she ended up in a place that they were very unhappy with, and that comes with a lot of guilt. Why, how did we not know that this wasn't going to be a great place? And I just remember thinking, I'm a middle schooler, high schooler. My grandmother eventually passed away when I was a junior in college. So this is like a decade my mom is doing this. And I just remember thinking at the time, this is really stupid, right? Why isn't there somebody who helps you find resources, figure out what's out there? Because people just don't know. You have no idea what that senior living place that you drive by on, every day on your way to work. Most people know that it's senior living in some way, but they have no idea what level of care it is or how you're going to pay for it or what those services actually are. None of that. until you're thrown into a moment where you have to go, oh, wait, I need to know everything right now. So when I had been professoring and those hours got cut back, I kind of looked at, my husband and said, I have talked since I was young about starting a business, doing this. And my degree is in working with older adults. My Ph.D. is in developmental psychology, specializing in adulthood and aging. And I always knew I wanted to work with older adults and their families. So once my hours kind of got cut back, I said, this is the time. This was in 2012. If I'm ever going to start this business, I should start it now. And so that's how I started making that shift to what I do now.
Okay, cool. And so I guess that's a good segue into what did you shift into in 2012? How did you get the business going? And then where are you now? What does that journey look like?
Sure. So when I started in 2012, I no entrepreneurial experience, zero. So I did not feel confident that I was going to be able to navigate this on my own. So I actually bought a franchise of what we would call a placement agency, which is an agency that helps families find senior living and doesn't charge the family any money, but gets paid by the communities that they're placing the families into. So the idea is that you're providing a service to the families, but you're also providing a service to the senior living communities, and they ultimately pay your fee. And that is a decent model. There's a lot of people that still do that. There's nothing wrong with it. But what I really discovered as I was into that for a couple of years was that there are people you can help there, but there's also a whole bunch of people you can't help because they are wanting to keep their loved one at home and they need to find all kinds of resources and they need all kinds of day-to-day help keeping their loved one at home. Or they're looking for home care, or they're going to use Medicaid to pay for their care because communities are only going to pay a referral fee for people who are private pay, people who are going into certain levels of care, things like that. So I transitioned out of doing placement. We really almost never do that anymore. It's very rare that we're ever even working with someone that's looking to be placed. And now we have transitioned to care management, which is fee for service. So we're charging our families now, not the communities, because we're not placing people in communities typically. So what we do now with care management is help families figure everything out, honestly. So we have clients who, most of them, their loved ones are here. So the seniors are somewhere in our area and the family members are either not nearby. So we have like a family member who's in the Philippines. We have another family, the closest family members in Finland. Other people are just in different states. And we're really their feet on the ground. So we go to visit their loved one either at home or in a community, every week, every other week. We're going with them to doctor's appointments and we're letting those family members know, hey, here's what happened or here's what's going on. And we're handling all the day-to-day stuff that they would handle if they were here. Some of the family members are close by, but they're working full-time jobs and they've got kids of their own to take care of. So they don't have time to really be caregivers for their parents, even if their parents are close by. So, we joke sometimes that we're like daughters for hire, sons for hire in some cases, but it's that we're doing all the things that those family members would do if they were close by or if they had the time and energy to do it.
That's interesting to me to think about. So maybe a bit of a sidetrack, but that's how my brain works. It leads into some of the bigger challenges, right? So you mentioned other countries, Finland, things of that nature. Finland, of course, I know has a very good national health system. So are these people where they just can't take the parent back, or are the parents, are these American families and so they just can't bring the parent over there and get care for them?
It's usually that it's an American family and the adult children are living and working in that other country, and it may not even be a permanent situation. They may know that they're going to be there for a year, 2 years, but it's not we've moved there and this is our new residence and hey, mom and dad, why don't you come over? It's
Yeah.
we're there for work, and eventually they're probably coming back to the United States. So,
Got it. Yeah.
yeah.
In that vein, there's a lot of challenges that arise from, I don't want to say mistakes, but I do want to say mistakes. What's the number one, if you had to say number one issue that you run into with this type of care, the service that you're providing, what's the number one thing that leads to people having to hire you?
Not planning. So a typical phone call for us that we get multiple times a week is, I need help. Mom or dad was fine until, and then you fill in the blank for whatever the event is that's happened. We've had a fall, we've had a heart attack, we've had some sort of major life event, and now chaos has ensued, right?
Mhm.
Now the adult children or the spouse, whoever is that primary point person, has been thrown into, I need to know everything. I need to know their financial resources. I need to know what Medicare covers. I need to know what the different levels of care are. I need to know what are the good communities at that level of care. I need to know, how do I get them into that? What are the steps to go through it? I need to know how to take care of the house if nobody's going to be there. I need to know, all the resources that are available to us in this moment. And now that I'm really upset and stressed out and have 5,000 decisions to make, I need to make life-altering choices for my loved one, and we have never had a discussion about it. I do not know what they would want, and I am completely unprepared to make those decisions. And we kind of joke that this is when people call us and they're like a cat who has their claws in the ceiling, and we are underneath them kind of trying to coax them down and saying, really, it's going to be okay. We'll catch you. And, just trying to talk them off the ceiling because they're so stressed out and lost, really. Just their anxiety is through the roof. And I mean, we probably get that call 3 times a week.
Okay.
And it's always that same story. Everything was fine until. And I think so many families, people will tell me all the time, they'll say, that's so great what you do. That's just amazing. My mom is 80 and she's doing great and she's living independently and it's just amazing. And it is. I mean, it is amazing. And my next question is, have you guys talked about what's going to happen when things aren't amazing? Because in the likelihood, at some point, things aren't going to be amazing. And sometimes people have, but a lot of times they really haven't. And it may be because the parent doesn't want to talk about it. It may be because the kids don't want to talk about it. But it's this sort of, well, we'll talk about it when we need to. When we get there, we'll do that. And my point is, you need to talk about it now. Everybody needs to talk about it now. I need to talk about it now at 49 to say what I want or don't want. If I go get in a car wreck today and I become incapacitated, my loved ones need to know what I want and don't want so that they can make the right decisions for me right now. There's no guarantee that I've got plenty of time to decide this when the time is right. The time is today.
That's and of course you and Serena, who's my wife, are friends, and a bit about, we've leaned on you a bit with some of our own family challenges. I grew up, my father killed himself when I was 10-ish. My youngest brother died at 19. I had a stepbrother die in his 30s of AIDS. All sorts of friends die along the way. So for me, this has been something that's inspired me to actually start this new project, I'll call it at this point. But we kind of touched on what these families, what individuals go through. you mentioned starting at 2012 and franchising, and now it's 2024. What was your journey like as far as, I'm assuming there's the business aspects. You mentioned entrepreneurialism. The business aspects, there's smart people out there you can find and connect with and go. There's also the emotional aspects of pushing through the failures. And you know a bit of my story. I mean, I've had plenty of entrepreneurial failures and a couple of successes along the way, but what was that like to get from 2012 as somebody starting your own business to where you are today? Because right now you're speaking, you're very much an expert in this field and you speak like it. And we could touch on, I know you wrote a book as well. We could touch on that, but there's a journey there between 12-year journey that I'm curious if you could share a bit about that.
Sure. So as I mentioned, I started off as a franchise, and 1 year, like almost to the day, 1 year into that journey, the franchise owners sent an email to all of us saying, due to our own economic and personal situations, we are closing the home office. This was like October 13th, let's say, middle of October. And they said, we're closing the home office effective October 31st. And you guys can keep the logo and you can keep your name and, good luck and Godspeed. And basically it was over, right? And I read the email and a massive migraine like immediately set in and I just couldn't even function. I went home after reading, and went to bed and could not, because it was just like, oh crap, what has just happened? And my husband, who's an attorney and also an entrepreneur himself, said, no, you don't understand. He said, this is great because you have gotten a year of experience and help and training from these people. And now you don't owe them anything. You don't have to pay them any more money. You don't have to share anything with them. And you're not contained by their rules anymore because now the business is yours and you can go with it in any direction you want. And that is what really allowed me to start transitioning into what I do now, which is care management. Because by then I did already see the gaps in what I was doing and that there was so much more that could be done to help families. So there was that piece of it. I will say, having no entrepreneurial experience and now being 12 years in, like you said, one of the biggest things I say to people if they're just starting a brand new venture, which I wish someone had told me, but probably I wouldn't have believed them. And I don't think any of the people I say this to necessarily believe me either. But I've had a few of them come back and tell me that it was true and they were glad I said it eventually. You got to give it 3 years. You got to give it a full 3 years before you really can expect any sort of profitability, because it just takes that long to get a foothold, to have done enough networking. And I'm sure there's exceptions. I'm sure there's somebody out there who's going to say, well, I had a great idea and a great product and I was profitable in 6 months or a year or whatever. But I think it's very typical to be 3 years in before you're really like, oh, this is going to work, right? Like this is going to make money. And that was certainly my experience. I didn't know that going in, and it was very hard emotionally because you just feel like a failure. You feel like, why isn't this working, right? Like I'm trying so hard and I'm doing my very best. So why isn't the phone ringing? Why aren't the clients coming in? And, I'm in a very different position now where if you don't want to hire me now, cool, that's fine. Because we're busy. And if we're not the right fit for you, that's okay. I certainly didn't feel that way for the first 3 years. I was like, you great, please come. No, don't. I absolutely want you. No matter how difficult you're going to be, I'll take anybody. But now, I feel a lot more confident in our cash flow and our client flow. And if somebody's not the right fit for us, that's fine. So it's a very different perspective.
I know recently you just released, I'm assuming it's your first book, but I could be wrong on that.
It is. Yep.
Keenagers. And so I'd like a little bit of background on what prompted you to actually follow through and write that, as someone who's started many ideas for books in the past and gotten 30 pages in and never gotten further than that. I know that there's just a lot of work that goes into completing a project like that. But then even after completing it, what I'm really interested in is, so we talked about, the biggest challenges that people face with not planning, right? So not planning. But out of your book, out of the research, out of your experience, is there like a David Letterman top 3 or top 5? Here's the things that you need to start doing today, and how often should you be following up on these things, and how do you mentioned you were 49, I'm 52. So we are definitely in the phase where we should be doing this, but I also think people should be thinking about this in their 20s and 30s.
Oh, yeah, absolutely.
So,
So that was like 5 questions in one. So
Yeah, I
so
apologize.
save the like top 3 lists and remind me of that in a
Okay.
minute. So I did write a book, and it's called Keenagers, and that's with a K, and it's telling a new story about aging. And it's really a book about preparing to live longer and healthier, and how to prepare for your older adulthood so that it's the best it can possibly be. And I actually interviewed a lot of people who are in their 60s, 70s, 80s and are doing all kinds of amazing things. And it's not that they don't have health problems. Everybody I talk to has a health issue of some kind. Some of them have had multiple heart attacks already, but they are still being productive, contributing, giving back, and have purpose in their life. And that's a big piece of it. So it's a very positive book. And one of the things I get asked a lot is, you're in care management and you're working with people and families who are going through these big health crises and doing end of life stuff. And that seems like really a downer, right? And then you've written this very positive book. And the way that came about, when I first got into this work, even with all of my training, so again, I have a Ph.D. in developmental psychology, focusing on older adults and aging. So I know something about older adulthood. And even with that knowledge, when I got into working directly with older adults and their families, I thought I was going to be working with 40-year-olds caring for 70-year-old parents. And what I'm doing is working with 70-year-olds who are caring for 90-year-old
Wow.
parents or 95-year-old parents. So our ideas about when you are an older adult, and I'm putting that in quotes, and when you become old, really have not kept up with our increasing lifespan. So when Social Security was first enacted and you got your retirement at 65, we really expected you to live to 67, 68. If you were really, really a go-getter, maybe 70. But our lifespans just weren't that much longer than that retirement age. Well, if you retire at 65 now, you're probably looking at 2 or 3 more decades after that retirement. And that is a long period of time to, quote, do nothing or only play golf or fish or whatever your favorite hobby is. Those hobbies are really fun when you do them sometimes. They're not really fun if they're all you do every day of the week for a year or more. And so what I kept seeing was, again, that I'm working with people in their 60s and 70s who are caring for their aging parents. And the people I'm working with, these adult children, are doing all this stuff. They're starting new businesses, they're starting nonprofits, they are caregiving, but they're also doing so many things to be purposeful and give back. And most of them, it's an encore career, right? Like they retired and they did it for 18 months or 2 years and they went, I'm kind of bored. what can I do now? And so they've gone back and done other things. And I thought, if I was so wrong about older adulthood and I have all this training, then everybody else is thinking about it incorrectly as well. We're not thinking about preparing for these extra decades that we have, or that so many people have, that are going to be in our quote retirement years, because our retirement years are so much longer now than they would have been before. So the point of the book is to kind of demonstrate that to people, to kind of explain what is happening demographically, and to think about, you do need to prepare. I do talk about caregiving. I do talk a little bit about end-of-life planning. But all of that is in preparation for a retirement that you want to look forward to, not just because it's going to be all leisure, but because you're going to find new and interesting ways to have purpose in your life. And you need to think about that. What's that going to be? So that's how I got into writing this, again, very positive book. Even though I work with what people perceive as negative, I don't see the end-of-life planning and caregiving and all those things as negative. I think it can be very stressful, like you said, because people don't prepare. It can be a lot less stressful if people don't prepare. But it's, I don't see it in the kind of Debbie Downer way that a lot of people do, because I see so many positive things that families go through in those experiences as well.
Yeah. Well, preparation, so there's a couple things I'm going to throw at you, and they will lead to that list, but you mentioned a lot of stuff that's very interesting. So preparation, so again, writing the book, so what was it? You were running a business, working full-time, taking care of your own children and family. How do you get a book done in between all of that?
So I'd talked about and thought about writing the book for probably at least 5 years. I started a blog at one point and wrote a blog for maybe 2 years, and then was like, this is not really what I want to do. The blog is not the right thing. And then I finally had a friend who had joined basically a writing program, which was designed to help you get your book written in a year. And I talked to her about what she was doing. She was having a good experience with that. And so I signed up to do that program that basically held my feet to the fire for a full year. And that was great in many ways because, number one, they assigned me a developmental editor who I had to meet with every single week and who was looking at me every single week going, what am I reading this week? What am I reading this week? The other thing about it that was great too is they said, you are writing your shitty first draft. It is going to be shitty. We expect it to be shitty, but you must write it. Every week we're going to write. We're not going to edit. We're not going to go back and look at what we're going to write it. Your developmental editor is going to read it. She's going to give you feedback, but you are not going to go back and revise. You're going to keep going. You're going to keep writing. And that's what I did. And that idea that it was the shitty first draft was so freeing because my problem would be I would write and then all I'd want to do is go back and edit it and try to make it better. And you can't do that. They also kind of had this mantra of we can edit anything, but what we can't edit is a blank page. So that really helped, put my feet to the fire in terms of I paid for this program. I am paying these people to make me get this done. I'm going to trust them. We're going to work through this process. And I got it done. They got me through it in a year. It's a miracle.
Yeah,
but they did. But it's that kind of, I'd have never been able to do it on my own because I would just get so wrapped up in trying to go back and re-edit what I'd already written to make it perfect. And you just can't do it.
Accountability partner.
An accountability partner, 100%. That's what I had to have. But also an accountability partner who knew what they were doing.
Yeah.
Right?
So.
Because having that editor who could say, this sucks, or this is really good, was really helpful to me too. I kind of needed that external validation of this is good enough, at least keep going.
Yeah. So back to my list question, but I'm going to change it a little bit based on some of what you just talked about.
Mhm.
You mentioned a number of things. So adult children caring for older parents, the age range is higher than what you expected when you went in. I'm taking a guess here. I don't know your fee schedule, but as we know, there's a trend that's been happening for quite some time between the haves and have-nots in this country. And the have-nots oftentimes have a few more challenges than the haves. So when we think about that, and we think about the service you provide, it's almost more important in my mind for the people without resources to be doing this planning, to be thinking about these things. Not saying more, more or less, but if you've got some resources, you can find help, and if you don't, maybe you can find help, but whether you know how to go about that or where to get information from can be a challenge. So I'm curious, besides, planning, but if we go a level deeper, what are the things that not only all of us can do, but people who are in positions where there's not going to be a lot of financial resources to help out? What are the things that they can be doing or thinking about?
So, the number one thing that I see is people thinking that Medicare pays for long-term care.
Mhm.
Medicare pays for your health care. It pays for going to the doctor, and it pays for your hospital visits and things like that. And it will pay for skilled nursing for up to 100 days after you've been discharged from a minimum 3-day hospital stay. Other than that, Medicare does not pay for you to live in skilled nursing long term. It does not pay for assisted living. It does not pay for memory care. It may pay for a little bit of home care in certain situations, but it's not going to pay for like round the clock 24/7 care in your home. And people do not understand that. So that is a number one thing when you are thinking about future caregiving and planning. You need to understand that if you um, have Medicare, that's wonderful, but it's not going to help in this situation. Now, what you said about the haves and the have-nots, you've got people who can pay for care and they've got plenty of money and it's not a problem. Then you've got people who have almost no resources. And actually, the people who have almost no resources get covered by Medicaid because Medicaid will help pay for long-term care in a skilled nursing or a memory care or an assisted living if you meet the poverty qualifications in your particular state. And it is different from state to state. Uh, It's actually the middle class. The middle class is the group that struggles the most because they make too much money to qualify for assistance from Medicaid, and they don't have enough money to actually pay for the care that they need. So, for example, in North Carolina, the cutoff for Medicaid for assisted living is around $1,300. I don't give or take a little bit. And what that means is your income per month can't be more than that cutoff number. If it's even a penny more than that cutoff number, the state of North Carolina says, so sorry, you make too much money. You have to pay for your own care. But the actual cost of assisted living in North Carolina is going to be somewhere between $3,500 and $7,000 a month. So there's a big gap between the $1,300 cutoff and the minimum $3,500 price tag. So there's a lot of people who've got a Social Security check, $1,500, $1,600, and they don't qualify for any assistance, and they don't have nearly enough money to actually pay for the level of care that they might need. And those are the people that get screwed over, honestly, because there's no way to reduce that Social Security payment and get them qualified. And it's just really hard because they will call and we will have to be the ones to break that news to them. And they're rightfully so upset because they've worked hard their whole life. They've had a good middle class income. They feel like they've done all the right things. And there is absolutely no help for them in that situation. Those people and their family members are the ones who need to be thinking about this the most, because they are going to get caught between a rock and a hard place if they have not really talked to their family members about, this is the reality of the situation, and who's going to be the point person for caregiving if caregiving has to happen, because we're going to need help. And we can pay a family member something to help us, but we're not going to be able to pay the assisted living price tag. And those are real discussions. It's very hard because it all feels very hypothetical, and we all hope it's never going to happen and we're never going to need it. But I get those calls from those adult children all the time saying, what am I supposed to do? Because they can't quit their jobs. They can't finance their parents' care. And here we are.
This might be a hard right turn off of that conversation, but I'm curious. We see this in other countries. We see it in this country in certain states, but and you don't have to answer this if you don't want to.
Okay.
But, when I think about people I know who might find themselves in that situation at 50s, 60s, 70s, assisted suicide.
Mm-hmm.
I mean, do you have any thoughts with regard to whether that's something that should be or could be an option for people?
This is my personal opinion, but I think everyone should have the right to decide their own fate without having to resort to asking their loved ones to kill them or having to pull a gun on themselves, that kind of thing. I definitely think it should be a human right to decide how your own life is going to end. There are several states, I think 13 states now, where assisted suicide is legal, but like Oregon, Washington, D.C., Washington State, I believe Colorado are some of them. And, in those states, you have the right to decide, I've got cancer and I don't want a long drawn out sort of thing, or I've got dementia and I want to end it before it gets to a certain point. And having been in this industry now for 12 years, I definitely think people should have that right to make those decisions for themselves. But also, you look at the financial cost to individual families and to the government of prolonged declines. Dementia is a disease that can take anywhere from 8 to 20 years before someone actually passes away from that. And, I certainly don't think anyone should be forced into making a decision about ending their life, but I certainly think people should have the right to choose whether or not they want to go through that, or at what point, how far along that path they want to go before they want to say this is enough.
Yeah. So I'll tie up here, moving from end of life to beginning of life.
Mm-hmm.
And so we talked about kind of your journey going from professoring to entrepreneurialism to where you are today. But where did you grow up? What was your childhood like?
So I grew up about 20 minutes south of where we are right now, in near Asheboro, North Carolina, out in the countryside. My grandparents lived right next door, and they had, I don't even know how many acres, but many acres. We had cows and a barn and all the things. And so I kind of grew up roaming the countryside. I think back on it now that I have children myself, and about me, roaming through the woods by myself for hours on end, and think, if anything had happened to me, bitten by a snake, fallen, it would have taken them forever to find me, because, I was just out there doing whatever, wandering through the woods, and having a great time. It was a great place to grow up, and that's still where my parents are, kind of out in the countryside in Randolph County. Yeah.
Yeah. Anything specific that kind of nudged you towards, the path you went through school-wise and things like that?
Just, living right next door to my grandparents, and then watching that whole experience happen. I did go to Elon University, for college, and I was the third generation in my family to go there. My grandparents met there in the 1920s, and then my mom and her sister both went there in the 1960s, and then I went there in the 1990s. So now I have a couple of kids getting ready to go to college in the next few years, and we'll see if anybody decides to go be the fourth generation to go there. But certainly, it's funny because I think I applied there just to make my mom happy. And I was like, oh, yeah, Elon. And then I actually went on a tour and I was like, oh, wait, Elon. And so it was it was the tour that actually sold me. So that family connection, though, is how I ended up there in the first place.
Okay. And then finally, we talked a lot about the things we should be doing.
Mm-hmm.
You've got business now, you've got a book, you've got children. So legacy to you, what does that mean? What are you doing to get things in place to leave that legacy? I think oftentimes people think legacy is financial. I think of it as something much bigger than that.
Mm-hmm.
And so where are you at with that? What are your thoughts on it?
So in terms of what I do and thinking about legacy, I've done as much planning as I can to make sure everybody knows like what I want. So, again, I'm in my 40s, almost at the end of them. And, we've had wills and healthcare powers of attorney and living wills and all those planning pieces. We've had those in place for years. I mean, because I can't, it's hard for me to sell it with a straight face and say, you need to do your documents if I haven't done it myself. And so, anytime I'm giving a presentation and talking about those things, one of the first things I'll get asked is, well, have you done it? And the answer is yes. Everyone should do it. And actually, my oldest child will be 18 next year. And as soon as he turns 18, we need to have healthcare power of attorney and all those things put into place, because once he becomes 18, we're not necessarily in charge anymore as his parents. So that's something everybody should be doing. I hope that would be part of my legacy in the sense that I did as much preparation for them as possible so that they know what I want, should something happen, and how to take care of me. That kind of thing. Financial legacy, honestly, I'm not sure I've ever really thought about that much. I think older generations think about that a lot. Like, I think my parents certainly think about that. That is very important to my dad. But I'm not sure it's all that important to me. And I look at my parents and I think it's really important to my dad that like my brother and I get an inheritance of some kind. That's part of his legacy. I think it would be more important to me that they spend that money on their care, right? That we make sure that they're getting the very best care that they can have to have the very best life that they can have, because they've worked really hard for that money. And I don't want them to shortchange themselves or to suffer in some way because they're trying to scrimp and save money to pass it on to me. And I think I view my own life the same way. I'm going to spend my money trying to make sure I get good care so that I also, my kids don't have to worry about it. I'm not going to worry so much about passing things on to them per se. I hope my overall legacy at the end of things will be, kind of fighting the stereotypes, the implicit ageism that our culture has, that it is all downhill, that growing older just is terrible, that everybody should be dreading it. I mean, because really, we are incredibly adaptable people. And as I mentioned earlier, almost everybody I interviewed for my book has health problems. They've got issues, and yet they are living purposeful, engaging, fulfilling lives. And I think when we're young, we look at older people, it's like an us versus them sort of thing, and we can't identify with them older people because we're kind of like, oh, I wouldn't ever want to have to live like that with any sort of disease or disability or anything like that. And then as you get older, you start to realize that, yeah, things change, but there's still so much joy and purpose that you can have in life that the aches and pains and the health, this and that, aren't as important as you thought they were when you were younger. And I hope my overall legacy will be helping to educate people about that, to help people move forward, look forward to their older adult years, to maybe get a few less people buying anti-aging skin creams. I mean, it's that kind of thing. People are making a lot of money off your fear of growing older. And if I could just fight that a little bit, I think that would be a terrific legacy.
Yeah. Snake oil salesmen have been around for a long time. So.
And they're still out there, 100%.
And
Yes.
It's a lot, the megaphone's a lot bigger now than it used to be.
Yes.
So,
yeah.
To that end, though, I'm curious, are you doing anything to capture, obviously you've got a book out, you do podcasts, you do all these things, but are you capturing stories and messages in any way for family, loved ones, things like that as you go, right? So are you doing a annual recording of something that isn't public, but something that could be left behind as an archive for people?
My sister-in-law bought one of those like storybooks for my mom to fill out, like to put her story in. I don't know if she's actually filled it out.
Yeah.
I'll have to ask her. I have typically done like annual, almost like yearbook kind of photo books for my family once a year to try to capture like what happened in that year. Right now, that's one of those things that I've done, and then I wonder, like, will these just be sitting in my house for the next 50 years? Or will my kids actually care? Who I don't know. But other than that, no, I haven't done any big story gathering sorts of things. I've thought about trying to do a podcast or something similar with Keenager type people, doing those sorts of interviews to try to capture them, but I'm not there yet. When the book came out, the book hasn't even been out a year yet, and one of the first things that started happening after the book came out was people who read it and enjoyed it and were inspired by it said, I need a workbook. I need it. Like, I've got your message. I believe it, but I need like an accompanying workbook or something to go with it to help me like actually enact some of these ideas and plans and things. And so right now what I'm working on is putting together, I'm not sure what it's going to actually turn out to be, but some sort of almost online program that people could do to accompany the book. You could do the program or have this workbook that may go with the program. Again, I don't know exactly how it's all going to shape out, but I'm starting to put that together to say this goes with the book and you can work through this if you want to kind of enact the ideas from the book. So that's the next thing. We'll see how it shakes out.
Oh, that's cool. I will say one thing I found I think is necessary in 2024 and going forward. I'm not going to push any specific platform because I have no skin in the game beyond. I've had two music friends that I played with for a long time die in their 40s in the last few years, and their spouses both had no idea about accounts, passwords. So I tell everybody, I don't care what you use, password manager, figure out something. Make sure that whoever's closest to you has access to it, because both of them, one of them, you met Justin, I'm sure, but he was diagnosed with cancer in October and he was dead in November. And, the other guy, Kevin, that I used to play with, he just had a stroke and passed away. And both cases, I was close with them and their wives were like, I can't get into emails. I can't get into this. And so getting through those things.
And that's kind of the doc. It's like part of the documents that you'd want to have. Although having like a notebook full of passwords is probably not ideal not because somebody's going to find it and get all your passwords, but because we have to update them so often.
Stay updated.
Yeah, it doesn't stay updated. So I think a password manager, and then having your spouse or someone know the master password for it, having that somewhere so that people can find it is essential. That's absolutely true.
I sincerely appreciate it.
Sure.
This was great. Like I said, we've known each other quite a while. It's been a while since we've hung out.
Mm-hmm.
Life is busy.
With 4 teenagers, it's a whirlwind.
Yeah, and our teenagers here. So Snappy just turned 12. But yeah, so I do appreciate it. I enjoyed it.
Yeah.
And I'll let you know when it's coming out.
Sounds great.
And thank you, Dr. Auman.
That's the category, huh?
You can't hang on to yourself. You don't have to try not to hang on to yourself. It can't be done, and that is salvation. The most important thing for anyone to realize is that you and every person you see will soon be dead.